Special good morning to our listeners, good morning to our viewers. Welcome to another edition of To The Point. It's Friday, the 10th day of April, 2026. Good morning to those of you also via social media platforms, whether it's a Facebook page, YouTube channels. Good morning. Welcome. I'm your host, GT. It's Friday, as mentioned before, and today on the program we have, of course, folks representing the DPM, as I like to simply refer to it as the movement. We have, should I say, making his debut on the program?
Yes.
Yes.
That is correct.
Good morning to, of course, that's Mr. Alvin Holas. Alvin Holas. Good morning to you, sir, and welcome. Of course, we have, Dr. Bird Bradford with us once again. Good morning to both of you. How are you doing this morning?
Not bad.
Not bad?
Nice to be here.
Yeah, nice to have you. Hope everybody enjoyed the Easter and everything. Couldn't have you last Friday. I mean, it was Good Friday. Hope it was a good Friday for you also.
Yeah.
Yes, it was.
All right. Well, gentlemen, welcome. And in the initial stage of this morning, we are suddenly introducing Mr. Alvin Holas with us this morning. As I mentioned before, making his debut on the program. How are you doing this morning again? How are you doing?
I'm doing fine, thanks. I'm in good spirits, and I'm happy to be here, GT.
Well, welcome. Let's get the ball rolling. We lost a couple of minutes already. Can you share with us, in terms of in your professional capacity and so forth, why you decided to become a member of the DPM?
Well, first of all, let me start by thanking you for having me on the program. And a little bit about myself. My name is Alvin Holas. I am the son of farmers, Ivan and Christopher Holas from Monlong.
All right.
Right. So, and of course, I am proud to be offering myself as the candidate for St. Andrew Northwest under the banner of the Democratic People's Movement, or the movement. My background is really in academia, international business, health financing, policy development, project management, particularly in health systems and national development. So I have worked across the Caribbean on major reform initiatives in healthcare, healthcare financing, and governance of health systems. And I'm really stepping forward because I believe in my constituency. I believe that my country deserves leadership that shows up, listens, and delivers results for the Grenadian people. Why the DPM?
I will certainly ask you that question.
So, my decision to join the Democratic People's Movement is really, it was grounded in alignment of values.
All right.
DPM represents a new generation of leadership that is focused on transparency, accountability, and practical solutions for some of the challenges that Grenada faces and other islands across the region. And so I felt that there was a gap between what people are experiencing daily and the policies that are being delivered. And I will emphasize, this movement is not just about politics.
Yeah.
It is about building systems that actually works for people, for the Grenadian people. And it provides for me a platform where I can contribute meaningfully to the national development agenda of Grenada.
If I may ask you this, now in a political landscape as Grenada, that is often dominated by mainly two main political parties.
Right.
Why do you believe that the DPM is the right vehicle for change?
Well, I firmly believe in the foundation of the party itself.
Okay.
DPM was not born out of a desire for power or anything of the sort. It was born out of simply a desire for a new way of leadership, an institution that embraces youthfulness, young voices in politics, young voices in representation and inclusivity for the people of Grenada. I mean, I grew up in Grenada in a two-party state.
Yes.
And you either green or you're yellow, right? And I'm not saying this to bash any sides, right? Because that is not my prerogative. But you know, what I have seen over the years is just a recycled manifesto packaged differently and sold to the people every time an election season comes around. And we have gotten to a stage where we've settled for the bare minimum from our leaders with limited accountability and transparency in governance and so on. And so I believe that the DPM gives everyone a voice. We're built by the people, and we're for the people, and our agenda, our policies are shaped by interactions with the people of Grenada. And we've been doing a lot of that, going out, speaking with people, whether it's in our in-Mayad sessions, whether it's through our house-to-house activities, you know, and different community engagements, because we believe in creating creating policies inclusive of everyone, and that will impact people. People must be at the forefront of it. So, yeah.
You know, in a previous statement, you mentioned, you as someone, you describe yourself as someone who is a bit passionate about leadership.
Yeah.
You said that a while ago. Now, what does servant leadership means to you in a context of, you see, in a Grenadian politics?
Well, one of the things I've learned, especially growing up, a young boy, growing up in a poor family, parents are farmers, I've seen struggle. I know what struggle is. I've lived it. And I know what brought me to where I am today is sacrifice and my parents pushing an education agenda for me. And that has worked for me, and I am actually the first university graduate of my family.
Okay.
And I have seen how that has transformed the economic structure within my family. And so, in terms of servant leadership, I believe in order for one to lead, you first must be able to follow, right? And I have lived my life as far as I've gotten. I understand the importance of remaining grounded and humble in every aspect of my life, and learning the importance at an early age on service to people and service to country. Because at the end of the day, what is a life if you're only living and thinking about yourself and building yourself? Now, I have had persons who have looked out for me throughout my life. Like I said, I came from humble beginnings, you know. And when I got my first job, and I remember going back to these people to repay them for their kind deeds towards me, and you know what they said to me? You don't have to give me nothing. You don't owe me anything. One day you will be in a position to help others who came from similar backgrounds. And what I want you to do as a repayment is to pay it forward. And that is to me the essence of life. And that is the type of teachings that has shaped me as a young leader. And so I intend to lead in service, lead with responsibility, and to always stay in touch with people.
Putting up yourself as a candidate for St. Andrew Northwest, how has that feedback been? The people, how's they gravitated towards that?
Well,
has it been overwhelming? How has it been for you since?
I will say the feedback has been very real and very honest. Right? People are concerned about various topical issues. And I mean, it's no secret in Grenada. When you meet with people, they talk to you about cost of living, they talk to you about job opportunities, they talk to you about access to healthcare. So I will say it has been a very real and honest experience so far. Yeah. What stands out most, though, to me, is that people want to be heard and they want to be taken seriously. Right, that's one of the things that stands out to me, and so there's a strong desire among the population for new leadership and fresh ideas, and I have been listening. I have been listening carefully. I've been using that feedback which I'm gathering on the ground, and so I am feeding that into contributing to shaping practical solutions for building a better Grenada that includes every Grenadian.
All right, great. We drew for a break. Let's take it. We come back. We continue the conversation. Stay with us, folks. To the point. Classic Radio GBN TV. We will be right back after the short break. Don't touch it out.
Right Choice Promotion presents Lyrics and Laughter, the ultimate pre-Mother's Day show. It's coming to the Grenada Trade Center on Sunday, May the 3rd from 5 p.m. Get ready for an evening of non-stop comedy, sweet Caribbean vibes, and pure entertainment. From Trinidad and Tobago, the funniest man in the region, Errol Fabian.
She said not even my shoes. I said no.
Humorous Calypsonians, Trinidad Rio.
Going back to basics.
And the Calypso princess herself, Kareen Ashe from the Spice Isles. 2 decades of legend, Randy Isaac, Little Reds, plus local comedy king, Robert White, Dillian Walters, Fat Man George, and Kareem Alexis, delivering lyrical mastery, 11-time Calypso Monarch scholar, all backed by the Heatwave Band, with special musical treats from Lyndon Langdon on sax and Jaleli Moses on violin. It's lyrics, it's laughter, it's music, it's vibes. Tickets just $75. Available now at gotofed.com and other outlets island-wide. Treat mom, treat your partner, treat yourself. Lyrics and laughter. Sunday, May the 3rd, 5 p.m. Grenada Trade Center. Don't miss it. Grenada, the fire's about to be lit. Get ready for the ultimate grilling showdown. Maggie, King of the Grill 2026 is coming your way. Saturday, May the 30th at the Monroe Plain Field. The search is on for the island's top grill masters. Do you have what it takes? Bring your flavor and compete in the chicken category, the seafood category, and the bold, most creative grill category, where daring ideas take the crown. And this year, the heat isn't just for adults. Introducing the Junior Grillers category. Schools and youth groups. If you're under 18, this is your time to shine. So fire up those coals, sharpen those grilling skills, and get ready to battle for grilling glory. Registration is now open. Call or WhatsApp 405-8458 to secure your spot. Maggie, King of the Grill 2026. Saturday, May the 30th, Monroe Plain Field. Come for food, stay for the vibes, and witness who will be crowned King of the Grill. Brought to you by Maggie, enhancing the natural flavor of your food.
Before the digital age, before the world moved at the speed of a click, there was a signal connecting a nation. In 1986, a journey in broadcasting began in Grenada, a journey that would grow into a trusted voice across the country. For 40 years, through radio and television, we've been there for the stories that shaped our nation, the news that mattered, the voices that informed us, the moments that brought us together. Your stories, your voices, your moments. The Grenada Broadcasting Network, 40 years strong, one nation, one network.
Welcome back, listeners. Welcome back, viewers, once again to the point. Classic Radio GBN TV. Of course, my guest, Dr. Burt, and of course, Saholas. Good morning to you both, and welcome back. Dr. Burt, of course, you'll be quietly sitting there listening. Of course, some Saholas there for a wee bit. I think it's your turn to get some information from you this morning once again. Our conversation will lead down to your line of work, if I would say, healthcare and so forth. We're going to talk about a wee bit about that. One of the topical conversation in Grenada today, we're talking about Project Polaris. And, I would like to hear the DPM's position on it. Now, given that Project Polaris aims to build a $250 million smart hospital, as it's been deemed to be, and medical city, what is the DPM official stance on this massive infrastructure investment per se. There's been lots of concerns in relation to, of course, especially about the operational costs and et cetera, that we have heard minimal about, and the debt sustainability of such project. How would the DPM-led administration manage, of course, a fiscal risk associated with such undertaking?
Okay, good morning again to you and to listeners. Before I answer your question specifically, let me say it was a real pleasure sitting and listening to young Alvin Holders here.
Yes.
This gentleman here hopefully represents, among others, the future of Grenada. And he hasn't told you, I didn't know much, some of the things he said, I didn't know about them, but I know about other things that he hasn't even mentioned.
Yes.
And that hopefully will make the public aware of.
Yes, so we certainly get into that.
Yeah. In terms of his background, his CV and what he achieved. DPM, first and foremost, is not against any project that is going to bring better health care to the people of Grenada. So if perchance for us to set up in a frame that would allow for better secondary care for people on the island, DPM would be for it in a big way. But what has happened? There's been big fanfare about it, and on the social media, full of all the clips and whatnot. But when you look into the substance of it, a lot of things are missing. From even starting from the outset of how the project has been developed, there's been very little information that has flowed from the details of what is going on. You haven't heard about things like environmental impact assessment studies, and we know the area. We know what happens in that area. I would have thought that certainly government would have brought that to the forefront. How does the ordinary man in the street, how is the ordinary man in the street going to be able to access care at an institution that, if it's linked to Mount Sinai and reaching Mount Sinai standards, you're going to have to pay Mount Sinai type fees? Now, how the average person is going to be able to? I can't go as a medical practitioner. I can go to Mount Sinai in the United States. It is too costly. If they come down here, even if they came down here and they were at a lesser rate, it's still going to be way above the middle income and lower income of the country. So the question of accessibility, affordability, very much in the forefront, how the whole project has been developed. Then there are issues which our deputy political leader, he dealt with that beautifully in a program on Wednesday night, dealing with issues of transparency and accountability. And I would ask myself, if the Integrity Commission looked at what is happening around that project, what they will have to say to some of the people involved and what they have done. That's all I will say on that score, right? So a lot is missing, and one would love to be able to give it a deeper depth of support, but you can't if you it's all very vague and you don't see how the average man is fitting into it. And listen, you have to ask yourself, is that the best way we can spend this kind of money? We have other facets of healthcare that are woefully lacking. The primary healthcare system, there are many weaknesses in it. Look at the Guelph Health Center, a polyclinic that should have been going as a polyclinic, opening up to 8 o'clock, well staffed. Look at in his own constituency, right? I just saw a note here from a lady that I will read later on social media. I'm not a fan of social media, but I suspect it's something that actually happened, because at least there's some pictorial evidence to support what the lady is saying, going to the hospital for a number of hours and not getting service. So what are the things that we can do that can make people be able to... I myself, I can tell you. I had a patient I saw a year and 3/4 ago, nearly 2 years ago. Referred the patient to the hospital because I'd reached the limit on what I could do in an outpatient setting. You know, that person turns back up with their child in my office a month ago. And I again looked at the situation, tried to see what I could do to help, but I got to send the person back to hospital. The person had a glorious runaround in the system, and the child needs to be attended to. So when things like this happen, and I have to tell you, nearly 2 years, when things like this happen, there have to be somebody's got to be brought to account. I know the hospital staff, the overwhelming majority of them are going to be very hardworking, dedicated, but the ones who are falling through the cracks, notwithstanding the limitations that they may have in terms of finances, etc., the ones who are falling through the cracks, they need to be brought to, some sort of disciplinary measures need to be brought to bear, because in health, if you make mistakes, if you fail to give care when you should give it, it isn't like a car that you carry to the garage and the chaps mismanage it and it go down the road and stutter and stall on, When you stall, you know where you're heading.
let me tap into you this. I mean, what more would you have, of course, you'll be all part of the DPM. What more would you have liked to learn about this particular project that we haven't heard much? What more would you have like to learn about this project?
Well, but
Sure, you can chime in on that. You can chime in. What more you would have liked to learn about the particular project in reference to all that we have heard from the launch and all the other information that was disseminated already? Yeah. What more would you have liked to learn about project?
Just to echo the views that Dr. Brathwaite raised, we as an organization, we are not against development, and we are not against the whole national discussion on Project Polaris, right? But when you have projects of this magnitude that cost that amount of money, and also you have to look at why you're engaging in projects of that nature. At the end of the day, the hope that I have is that the project is intended to benefit the people of Grenada, Carriacou, and Petit Martinique. So we are saying that these projects, they must be approached with full transparency and public engagements. There are too many unanswered questions surrounding that project, and even we, as much as we engage with the media and we share our sentiments and we reflect the views of the people of Grenada, Carriacou, and Petit Martinique as we interact with them on a daily basis, we still don't get the answers. Yeah. And to me, that shows some level of disrespect to the Grenadian people from its leaders. It's like we don't value the concerns of our people and the trials they are facing and so on a daily basis. And that is one thing. So projects of that nature, they must benefit the people first, right? And there must be proper consultation. There must be disclosure. There must be some level of accountability. And so it has to be approached in a responsible and an inclusive way when you're talking about development of that nature. Now, the people of Grenada, they deserve to understand the impact of this project on the use of land, yes, on the economic opportunities that will come out of a project of that nature, because obviously we know you will need manpower, you will need human resources, right? What benefit and opportunities it will bring to the people, right? You need to also include the trade unions and other bodies across the island, because when the project is complete and operational, you're just going to pick up the staff from the general hospital and just drop them down in that smart hospital. What is your plan for training these individuals, for improving working conditions for these healthcare workers in Grenada? What is the operational plan for running a hospital of that magnitude? Because it is going to take time, it is going to take money, to run that hospital.
So true.
And where is the money coming from? What is this sustainability plan? Right? Because it's all well and good to launch and show us good 3D images of what could be. But when it is, which I have hope, it could be a reality, it could be possible. But what is the plan, the operational plan for such an investment? And then you have to look at also environmental sustainability.
Yes.
And the impact on the environment, right? So it's not that we're against Project Polaris. We just calling on the government to be more transparent and be real with the people, because the people have questions that are continuously unanswered, and we're being met with when the people ask questions, we tend to politicize it and shift away from the issue at hand. People in Grenada deserve to ask questions and not feel as if you're being political. But you see, we have created such a culture of politicizing everything that if I ask a question on something that the government is doing, you ain't supporting us. You're against development, national development. But it's okay to ask questions. That's how we learn.
I certainly agree with that. Anyone else?
One area that the government has recently, in the last year or so, started to work on, which this has started to work on from 2023. I give them 6 months to get to the feet in. From in 2022, from 2023 it should have been on, and that's the statutorization of the hospital. That is something that one should support, and it could, and there's an attempt to bring the various bits and pieces together on that, but it has been very late in coming. Actually, healthcare, as it relates to primary and more especially hospital care, has been on go slow until now we come near election period, right? And that's not good enough. That's not good enough. The issues are too burning. The issue of national health insurance, which a lot of work had been done on, lots of work had been done on it. It was only out there now to start to implement it. Now the government looked at it and they decided, well, they weren't going to go down the route that NNP government was doing. Fair enough that you were the government in power, but once you made that decision, you should be clear, and you by now, you should have been rolling out. You should have been rolling out the national health insurance, because it's something that requires a lot of discussion and debate. It is not something that people will necessarily rush to buy into, because people want better health care, but with the inflation and whatnot, people, somewhere along the line, you have to pay for it. Health care is expensive. And what worries me is that health care, and you're going to take up that type of fund to put into a new hospital, and against a background where inflation is going to be driving it. It is clear, irrespective if tomorrow or today everything in the Middle East settle, we still face serious economic strains down the road, and therefore we have to prioritize very carefully the mortgage that we have to pay on that investment. I'm sure it's going to be tremendous, right? In terms, should you be taking a few of those millions and looking to spend it in various polyclinics and various health centers in Princess Alice, etc.
So true.
And if I may, just to stick one point in there, please, if you will allow me.
Go right ahead.
To piggyback off of what Dr. Bradford just said, we need healthcare now.
Yeah.
So while we invest in the development of a modern hospital, people are sick now. Yeah. People need healthcare now. People are dying.
So you can't forget now.
So you can't forget the now while you're developing what is to come for the future. Okay. And when you look at things like in 2024, the government approximately, and I'm subject to correction, but approximately $24 million from the health budget was unspent. And last year in 2025, they cut the health budget by approximately $16 million. So when you're seeing the problems we are faced with now, and and these decisions are being taken, and these issues are occurring, you have to beg the question: where does the government's priorities lie when it comes to healthcare and what we are doing now? Because healthcare is not something where you can make any quick fixes or put a plaster or a bandage
it's a growing process,
on the sore, right? It's a growing process, and you have to continuously tend to the issues facing healthcare, right? So I just thought I'd stick that.
And to follow up briefly on that, government came into power, the NDC government came into power, which that is one of the major issues with the NMP, the poor quality of service in the health system, and especially at the hospital. But
I certainly agree, but I want to still keep healthcare, and, in terms of the DPM plan. So how does the DPM plan to implement? You spoke about it, so that's why I want to chime in on it. In terms of the National Health Insurance, the NHI, and the ways of how to ensure that Grenadians who choose that between, we have to choose between our savings and our lives. How does the DPM plan to get that implemented? If you have that plan that you want to show, maybe you don't want to share it now.
Well, briefly, the national one needs us to go back to the work that NDP had done, and look to build upon that, develop the whole structure. We have systems here. We have the National Insurance System, NIS, which has been one of the success stories. You have a model there that you can use, and I have been asked to make some input into the process authorization, and one of my major themes has been, for goodness sake, set up a system that will allow non-governmental interference in the system. You want a body that is set up that is independent of any minister, be it a minister from DPM, NDC, and MP. But you've got competent people from across the society functioning on a board and looking to develop this whole process, and you then develop a packet of basic health services that everyone will be able to have accessibility to. So this question of not having, be able to get basic medication, if you combine that with having a hospital properly statutorized with a good board again, in both instances, and you combine those two areas, you're immediately providing some pathway for funds to be flowing into a system to allow people to get a better basic pack. I mean, people go into hospital and have to rush outside. You got sickness, you know what sickness is. You got to rush outside, rush around a number of pharmacies to get some medications that the hospitals to be stocked up on. No, you want a system. You come in and you're going to be billed, right? Your plan, but hopefully will allow you to be able to, once it's a simple level of operation, to cover most of your expenses because you're being taxed in some form or the other. Governments might want to call it that, but it's taxation in whatever form it takes. And I say a lot of work was done on that, and the government wasn't wise in not following through on that.
I understand. No, with the global situation as it is right now, especially when it comes to healthcare and healthcare provisions, etc. With the supply chain issues that is going on right now, we're talking about the rising costs. How can Grenada ensure a consistent supply, especially in specialized medicine and medical equipment? How can Grenada even leverage international partnership? Mm-hmm. Exactly. We have the Mount Sinai Agreement and so forth. To buffer against those economic violation that's going on right now. I want to chime in on that for me.
Okay, so in terms of the global situation and healthcare provision, some of the challenges if we have not been faced with them yet, we are going to be faced with.
So true.
Is the rising cost of medical supplies, right? We already have workforce shortages in Grenada, and so there is also supply chain disruptions and all of that taking place. Now, small island states like Grenada, right, are particularly vulnerable, right? And you know, as a child growing up, they would say, when America sneezes,
we catch the
cold, right? And other developed nations. But what we have to do in Grenada is we have to build resilient local systems in Grenada and strengthen regional cooperation, right? As well as invest more in preventative care or preventative services to reduce our long-term costs when it comes to healthcare. Because at the end of the day, we cannot depend solely on external systems to help us, right? And we must strengthen our own capacity here at home to be able to deliver good quality healthcare to our people. Now, in terms of benefiting as a whole, in terms of procurement and all these other areas when it comes to medicine and medical supplies and all of that. Now, currently our system is highly fragmented. We operate in silos. We run healthcare on a budgeted approach, right? Now, in healthcare financing, if you run healthcare on a budgeted approach, your budget, let's say you budget $30 million to run the hospital for the year. When that $30 million done, it's done, right? But when you use a cost accounting strategy or a cost accounting method to running healthcare and financing care, you basically implement systems where you are able to gather data and make informed decision on how you go about spending on healthcare. Right now, we don't know what things cost, right? We don't know what is the cost of the inputs into healthcare. So everything we do is a guesstimate, a budget, right? And so even I remember when we was doing some work in Grenada, one of the studies showed that to do a simple procedure in Grenada, let's say something like appendicitis, it was gazetted way back in 1959, and it was costed at $6,000. Now, I don't know if that was just a figure that was came up with for the cost of that service, but we're still using that same gazetted cost today. And of that $6,000, right, the patient would contribute, I think it's $250.
Yeah.
The government would contribute $100. So the hospital is in a deficit for that one simple procedure of over $5,600. Or even more. So, and then what does that translate to at the end of the day? Limited supplies and the inability to procure and pay for supplies when you order it. Longer wait times in the emergency rooms, and growing frustration among patients and healthcare workers alike. You have the inability to hire, train, and retain staff. Because now we're complaining that all our nurses are getting trained here in Grenada at our noble institution in SGU. And then when they're done, they're taking the first opportunity to go to North America and Europe because they're getting better compensation for their skills, right? So that is what it translates to, because we don't know what things actually cost. And what a NHI or a universal healthcare system does, and I'm not saying that it will fix all our problems, but it gives the opportunity to create a technology-driven system. So you're able to incorporate technology where you're able to gather the data.
Yes.
And once you have the data, you're able to process it and know what things cost. So patients will be able to register and be given unique ID assignments. You're able to do real-time claims adjudication and payment, electronic medical records, because today we still operate on a paper-based system, right? So you might go to Dr. Brathwaite in his private practice, and he might send you to run some labs, and you bring that back for him. But then you go in the public system, and that doctor, there's no interoperability in the systems where they're able to communicate with each other. So you might go in the public system and they might send you to run the same set of labs.
Whole process regards.
Does that make sense? Right? Dr. Brathwaite should be able to pull up your ID, your unique ID number, and get your electronic medical records and be able to see the patient history and all of that, and also the cost that goes into all these services, because there's a lot of leakage in the system as it stands now. I'm not saying it's the fault of the current government or the past governments, but these are the issues we are faced with, and at this point, we're past blaming any political organization or government.
Well, the question is, why have this thing has never been done before?
Dr. Bradford?
What happened? One of the things, to be fair to the NNP of 2018 to 22, it was COVID.
Yeah.
COVID put a severe, it's something that people, it became politically useful for the opposition at that time to have said a lot about what was happening. Yes, I'm not saying that more could not have happened, but COVID was a severe damper. A lot of things that I remember the minister who was responsible for health at that time, he had to turn his attention 100% to the way to management COVID for 2 years. So that is why those things, some of those things went into the background. But we have had opportunity to get these things back up and running, and we haven't done them. And this will be one of the tasks of DPM if it was elected to government, to ensure that this time, and you want to hear what Mr. Wells here said, that how he's showing how we can use the technology to bear. It's not technology that will find money for you, but technology allows you to use to know what you're about and use. You talked about supplies. That is something that concerns me deeply, because we have to have strong regional links with the public procurement in St. Lucia. We do have links, but we have to make sure we are paid up all the time. We are making substantial inputs there so that the medications, when they come through, because it's not only about now getting supplies, it's going to be about quality. The quality is something that I have been concerned about, and I had wished that in Georgetown, I think they'd set up some facility to be able to check pharmaceutical standards, but I don't know how far that is going.
And you see, like I mentioned earlier, the current system is very fragmented, right? We operate in a lot of silos. And what really works for small islands like Grenada is consolidation, right? When you take the consolidated approach, where you bring all of the key players in the system together, and you're able to negotiate as a bigger body, then you benefit from economies of scale when it comes to procurement and purchasing, and so that lowers the cost when purchasing medical equipment and medicines and so on. And I think that, with credit to the OECS, I think that is what the procurement has been set up and is intended to do, and it has been working for the region. But there is a limited amount of supplies in terms of what's on the list of items that is procured through.
But it was supposed to be to allow a basic package of medications to be there. Right. Some of the more expensive and exotic medications would not have been there, or if they were there, they had to be given specifically by only by specialists, right? And in well-defined situations.
So we're not calling for a reinvention of the wheel. Yeah. The system, some of the systems already exist. What we need to do is build upon that foundation and make it better. Yeah.
Apply those tweaks and make it even better than already. Yeah. We drew for a break. Let's take it. I see my phone's already going, but we'll come back after that shortly. Folks, stay with us. To the Point, Classic Radio, GBN TV. We drew for that break. Let's take it. We'll be right back.
Grenada, the fire's about to be lit. Get ready for the ultimate grilling showdown. Maggie, King of the Grill 2026 is coming your way. We have a pot on the fire, Saturday, May the 30th at the Monroe Plain Field. The search is on for the island's top grill masters. Do you have what it takes? Bring your flavor and compete in the chicken category, the seafood category, and the bold, most creative grill category, where daring ideas take the crown. And this year, the heat isn't just for adults. Introducing the Junior Grillers category, schools and youth groups. If you are under 18, this is your time to shine. So fire up those coals, sharpen those grilling skills, and get ready to battle for grilling glory. Registration is now open. Call or WhatsApp 405-8458 to secure your spot. Maggie, King of the Grill 2026, Saturday, May the 30th, Monroe Plain Field. Come for food, stay for the vibes, and witness who will be crowned King of the Grill. Brought to you by Maggie, enhancing the natural flavor of your food.
Are you looking for the right engine or transmission oil for your vehicle? The place to go.
Right Choice Promotion presents Lyrics and Laughter, the ultimate pre-Mother's Day show. It's coming to the Grenada Trade Center on Sunday, May the 3rd from 5 p.m. Get ready for an evening of non-stop comedy, sweet Caribbean vibes, and pure entertainment. From Trinidad and Tobago, the funniest man in the region, Errol Fabian.
He said not even my shoes. I said no.
Humorous Calypsonians, Trinidad Rio.
Going back to basics.
And the Calypso princess herself, Kareen Ashton from the Spice Isle. 2 decades of legend, Randy Isaac, Little Reds, plus local comedy king, Robert White, Dillian Walters, Fat Man George, and Kareem Alexis, delivering lyrical mastery, 11-time Calypso Monarch scholar, all backed by the Heatwave Band, with special musical treats from Lyndon Langdon on sax and Jaleli Moses on violin. It's lyrics, it's laughter, it's music, it's vibes. Tickets just $75. Available now at gotofed.com and other outlets island-wide. Treat mom, treat your partner, treat yourself. Lyrics and laughter. Sunday, May the 3rd, 5 p.m. Grenada Trade Center. Don't miss it. Grenada, the fire's about to be lit. Get ready for the ultimate grilling showdown. Maggie, King of the Grill 2026 is coming your way. Saturday, May the 30th at the Monroe Plain Field. The search is on for the island's top grill masters. Do you have what it takes? Bring your flavor and compete in the chicken category, the seafood category, and the bold, most creative grill category, where daring ideas take the crown. And this year, the heat isn't just for adults. Introducing the Junior Grillers category, schools and youth groups. If you are under 18, this is your time to shine. So fire up those coals, sharpen those grilling skills, and get ready to battle for grilling glory. Registration is now open. Call or WhatsApp 405-8458 to secure your spot. Maggie, King of the Grill 2026, Saturday, May the 30th, Monroe Plain Field. Come for food, stay for the vibes, and witness who will be crowned King of the Grill. Brought to you by Maggie, enhancing the natural flavor of your food.
Welcome back to our listeners. Welcome back, viewers. It's To The Point Classic Radio TV and TV. Just have a few more minutes left on the program, but I will be stealing another 5 or 10 minutes after the initial time to wrap up this morning. We'll give the opportunity to listeners out there and viewers who wants to ask a question or two. But I want to tap in on that with you, Mr. Hollis, in this segment before we move to the callers. You know, agriculture and health, somehow they mesh together for some reason or the other. I mean, you coming from the Monglong area, as you mentioned, you understand? I mean, that's a agricultural area, we'll say. Tell me, how do you plan to link the local farming with, the national nutrients goal, per se, to reduce that non-communicable diseases, etc.? I mean, Dr. Bird could chime in on that also, if you get the drift away my question as well. What specific policies would you say would you support and make in terms of eating local and more affordable, especially for, the imported process that we go through in reference to food and so forth? If you get where I'm going with this particular question. Yeah.
So, GT, again, being the son of farmers and coming from a farming community, and in fact, my entire constituency, St. Andrew Northwest, is predominantly farming, right? You cannot leave agriculture out of the conversation when you're speaking about healthcare and national development. Agriculture and healthcare are deeply connected, right? And so I remember in IT, when I was doing IT in secondary school, there was this philosophy: garbage in, garbage out. What you put into the computer is what you will get out. And the same can be said about our bodies, and I'm sure Dr. Brothers would agree.
Yes.
You put garbage into your body, and you're going to reap the rewards of poor health and a low quality of life. And so when it comes to the conversation about agriculture and healthcare, they are deeply connected. And so what we eat directly impacts on chronic diseases. And Grenada is plagued with NCDs right now. We have a high rate of diabetes and hypertension, and I can go on and on listing all the NCDs that are plaguing our people. Now, when you strengthen agriculture and you invest in agriculture and building the farming community, you're able to improve food security, right? You're able to reduce your reliance on imported and processed foods, right? And also you support healthier lifestyles. And I would like to see a Grenada where we have policies that speaks to farm to table initiatives and encouraging local, growing local and eating local, and not just in the media, because yes, you have a part to play as well in terms of educating our people, but we have to reshape our culture, our consumption culture here in Grenada, and also start from the schools. So you start with the children, because reshaping a culture, it starts with generation, with inspiring and motivating a generation to want to eat healthy, to understand the importance of healthy eating habits, and growing what you eat and eating what you grow, and so on. So we need policies that support local farmers, promote farm-to-table initiatives, and you have to integrate nutrition. You have to integrate nutrition into the national health strategies and the policies that you are building and developing. So it's about building, at the end of the day, a healthier population from the ground up.
I will certainly agree that. I would say, you will hear lots of politicians, especially in around the campaign, speak a whole lot about what they're going to do for agriculture. I'm sure you have heard it before, Dr. Britt, you have heard it before. And then the process comes around. How serious is the DPM in reference to wanting to see the growth of agriculture?
Well, I think very serious. If you go back to what our political leader, Honorable Peter David, about 3 weeks ago, he called upon government to look at making far deeper investments in agriculture, especially based on what we face globally. There is expected to be some items will be in short supply, be fertilizer in short supply, some items are going to be in short supply. And as Mr. Alvin here is saying, Hollis is saying, you want the farmer out there, you have to give them the best chance to be able to get that produce to the market. And our deputy political leader just this week referred to the Marketing and National Importing Board. That would be a prime point of a democratic people's movement agenda to get that back up and functional. So you have to get out there probably and subsidize. And my own feeling, I'm not a financier like Mr. Wallace is, but I think on the swings you gain much more, because when people are eating food and they're eating lots of bad food, and instead of eating your locally grown foods, you know how many people turn away from your yam and your potato, your green fig and your this is the substance of what is healthy for you and go and bring the imported, as he said, refined foods and take all the sugary drinks and whatnot. So you have all the strategies that he mentioned. You go out in the farming community and you pump much money into it. And he also looked, the deputy political leader, Mr. Hardy Gill, he looked at discuss the question of employment and making sure that you have a workforce. That would be a major plank of a DPM government, to make sure that you have a workforce there to get the agricultural projects going. So even though it might mean that you're subsidizing the product coming to the market, at the end of the day, you're going to save some people becoming obese, who finishing up with hypertension and diabetes, and when you have to get dialysis, you know what the cost of that dialysis is? It's prohibitive for most people. The government has to turn back around to save a life and pump, right? So that would be a strong, and I hope, I haven't heard any response from the government, but I hope the government has listened to what our political leader, Honorable Peter David, has suggested, that they come forward with an advance and a deeper direction for supporting agriculture using all the methods I discussed.
Okay. Well, we get to that stage of the morning when we're going to open up the lines. I'm sure there are listeners and viewers who may like to ask you a question or so in reference to our conversation this morning. 435-2041, we have both the direct line and the WhatsApp. I beg of you callers to be very brief, if just one question, so we could accommodate as many callers as possible. 435-2041. We do have a first caller on the line. Caller, you're live via the direct line. Good morning and welcome. Caller, good morning.
So all the gentlemen on the line, good morning to you guys. And I just want to say that this is a conversation we should be having. This conversation should be happening at a public level, a public consultation on this issue. That's the complexion of healthcare public consultation we should be having. What we're having now is what's going on nationally is some argument and debate about structure and some building and some hospital structure. And if you have a concern about it, or you hate the government and you don't like healthcare and you're not into that, what we have going on now is a distraction from what we should be talking about. And Fuller is right, Dr. Brackett is right in terms of the topic they're touching on. We should be talking about services. We should be talking about reducing waiting time. We should be talking about policies, procedures. We should be talking about health insurance. Why is it's not on the top of the agenda? The public must have ownership of these issues. We should be talking about emergency management, the emergency department. How could we improve it? We should be talking about mental health. How could we get support for extreme mental health patients in the community? How could we get medication to the people and medication to mental health patients? A database of all the extreme mental health people, the patient health information. That's what we're talking about. That's what we need to be talking about. That is what healthcare is. Healthcare is not necessarily the building and the structure and all these issues. Policies, procedures, workflows, services, how we pay for it, national health insurance. And that is the conversation we should be having at the national level, at the community level. That is healthcare. That's my contribution.
Thank you, caller. Thank you so much. Any response to the caller?
Well, I just want to thank the caller for his points, and I totally agree. And like I said earlier, GT, and even on break, I told you, I don't believe in bashing political parties and governments, but what I believe in is discussing the issues and coming up with viable solutions while including the people in the conversations and educating people, at the end of the day. That is my MO.
All right, we do have another caller. Caller via WhatsApp, you're live. Good morning. Go right ahead, please. WhatsApp, caller, you're live. Guess we lost that caller there. Let's go to the direct line. Caller, you're live. Good morning. Welcome.
Good morning. Two questions.
Go right ahead, please.
So, during the groundbreaking ceremony, the government made the experts available to answer every and all questions. Why were none of you guys there to ask any of these questions? That's question number one.
Caller, question number 2, and then we respond. Go right ahead, caller.
DPM and NNP was in power for more than 10 years. Why the questions and concerns that are asked now, why wasn't none of these raised 10 years ago?
Thank you, caller. I'll give the, of course, guest opportunity to respond to you.
Well, I think you call them NNP and NDC being
more or less. I think
you couldn't,
probably slip of the DPM.
No, not DPM. DPM is hoping to come to power, yeah. And the other question you raised was the question of
not being there.
Well, why you weren't there,
why you
right?
not there to answer.
Okay. For sure, I don't know if the hierarchy of the party were invited, but certainly I've been connected with health. I personally didn't get an invitation, so I wasn't about to, go to some place where I wasn't invited. But we have made it clear that it is not that we are against Project Polaris, and if you want to get a feedback, that there's a role there for the public assembly like that. But you also, this is such an important thing that you will come to a political party and seek to get a feel from them. All the political parties, the NNP, the DPM, individually, and say, look, this is what we want to promote. And you go to the Chamber of Commerce, you go to perhaps they've gone to the other organization, but I'm not aware of the fact that they have come to us to sort our opinion.
And when you're engaging in matters of national development, stakeholder engagement, extensive stakeholder engagement is always encouraged. And so you're not just reaching out to political parties or NGOs and so on, but even going on the ground with the people, across the island. That is also a recommended best practice. And so much of that hasn't been done in Grenada with this project.
Okay. We do have another caller via WhatsApp. Good morning, you're live. I'm not sure if we're having an issue with the WhatsApp this morning. Let's go to the direct line. Direct line caller, you're live. Good morning.
Good morning, Mr. Telesford. Greetings and greetings to your guests.
Good morning, sir.
As a conscientious contrarian and creboja, I express an observation and ask a question. You see, Mr. Telesford, all that is being said this morning sounds all nice and dandy. But the thing is, and this is a comment made by the young gentleman named Mr. What is his name? Holas. He made in relation to IT and otherwise the term garbage in, garbage out. And it begs the question, why is it over all these years we haven't been able to improve anything? Take a look at it. 50 plus years we've all been, each administration comes in, is a whole load of old talk. And why is it at the end the results don't show any enhancement and development? Because we put in garbage, so we get garbage. So there we go, the question, why is it that continues to be? My opinion, as I move to my question, is that the system upon which this here country is built and been operating for 50 plus years is not deserving of the people, and neither is it in the interest of the people. Because we are a colony of Great Britain, and the system has been so designed only for the administration to operate and not the people, so the people never benefits. Question. What views do these gentlemen have on the reconstitution of this nation so that the Grenadian people can design a constitution for their future in consensus as much as possible? What are your views on it, especially the young and aspiring politician there? I trust my question is understood. Thank you very much. Do have a nice day, will you?
Thank you too, sir. Have a good one. Respond to the call.
Okay. Thank you for your question, caller, and your comments as well. Now, firstly, I am humble enough to know that I don't have all the answers and all the solutions to the problems we face as a nation. But when it comes to constitutional reform, yes, there are many archaic clauses and so on that requires revision. but you first have to engage again in extensive stakeholder consultations with the different bodies that exist and the people of your nation to see what are the areas that we need to reform and make amendments to, and so on. And so in those public stakeholder engagement consultations, then I believe we would be laying the foundation on which where we can then further the conversation of constitutional reform and amendments to certain existing laws and so on within our nation. In addition to that, some of the comments you would have raised in terms of all the years of things not being done, I will say things, I wouldn't say things have not been done. Things have been done. It has been done at a slow pace. It has been done not necessarily always in a transparent way, but we are at a point where I'm not going to dwell on what has not been done in the past, but let's look at what we have before us today. And let us come up with strategies and viable solutions to solving our challenges that we are faced with today in our efforts to build a better Grenada.
Okay, we do have another. You want to respond?
Yeah, just briefly, I agree with the caller with respect to the fact that it is abundantly evident that there's got to be some fundamental change, not only here in Grenada, throughout this Caribbean. We see the world scenario that we are living with now. And as Professor Justin Robinson has said, no one is coming to save us. And there's got to be complete restructuring of the system. Yeah. But that restructuring is going to require not only the government in power, but the opposition forces and the unions and the various non-governmental organizations working, because the public services we know and we have inherited, which is structured within the Constitution. If we want to survive, we need to give a serious look at that, and that is what I like about DPM. DPM is prepared to take on those challenges, and I've heard the political leader, Honourable Peter Davis, speak about it, and the deputy political leader both speak in that context.
Okay, let's try our WhatsApp caller once again. Hope it's up and running this time. WhatsApp caller, you're live. Good morning. Still having that issue. Let's go to the direct line. Direct line caller, good morning, you're live.
Yes, good morning. I've been listening to your program a while ago, and I think Mr. Broffett and the other guy, I think I need someone long away, especially Mr. Broffett. You know, y'all was with NNP for all these years, and things was nothing. As soon as y'all come out, y'all have the worst thing to say about Keith Mitchell. I'm not an NNP. I'm a supporter of the new the Democratic Party, NDC, right? But what I'm saying to you, there is only two parties in Grenada, NNP and NDC. Peter David Party, all what Peter David has done for the tongue of St. George is to buy himself a water boots and a cutlass and stop all this nonsense y'all getting on with. Have a blessed day. Bye.
Good morning, caller. Thank you. Thank you for your contribution.
Let me just say to the caller, as far as I'm concerned, I personally have not attacked NNP other than to say things that I saw that were going wrong, and I have been in full praise for a lot that the former Prime Minister has done. People have chosen to ignore it. So I'm not here about bashing people, but I'm here about looking at the situation objectively and speaking to where we need to move forward from here.
Yeah. Okay. And I will also say, I mean, at the end of the day, one thing I have in common with you, caller, and I hope that you are a Grenadian, is that we are both Grenadians. And I am not here bashing any party either. I am here to speak about Grenada, where we're at, and the prospects for building a better Grenada. And I am willing to engage with you in any setting to have a civil conversation about national development. I'm not interested in political parties and who did what and who ain't doing what. No, that's not what I'm about.
Okay. We take another caller. This will be our final caller for the morning, and then we get some closing remarks from you both. Caller, you're live. Good morning from the direct line.
Pleasant morning, GT, and pleasant morning to your panelists. I was just like, I'm listening, and I realized that the young man, he's young. I'm hearing him saying, but I'm hearing him saying about having discussion. Grenada have reached a stage, you have to understand, this is a wheel in motion. Grenada have reached a stage where Grenada need leadership. Grenada need leaders. The Grenadian don't need persons to say, come, let's talk and let me see what would happen. No. Just as a person speaking about Polaris and they say, hey, what we need is attention to the immediate hospital. So the day-to-day health care can be given to the people. That's what we need. What I'm hearing from the gentleman is, okay, we need to talk, and I think this, and I think that, and I think the other. My brother, your leader have been into politics, and the person who called it right, when they say the DPM have been in office for 10 years, your leader have been in frontline politics and have been the MP for the Tonga St. George the longest. I would like for you, my brother, as well as Mr. Buffett, if they could tell me 3 things that Mr. David, the leader of the DPM, have done for the Tonga St. George. I ain't saying Grenada, the Tonga St. George, who have made him the MP, the Member of Parliament, for several years. 3 things. Thank you.
Thank you, caller. And that was our final caller for the morning. Respond to the caller.
Yeah, Mr. David has done lots of work in developmental work with the River Road project. Road's all about. He started the work on the reconstitution of the on the hill there where the police center was before the headquarters was.
Okay.
And he would have done lots of work for individuals and help to promote activities within the from a play point of view amongst the youth, got the youth together in many formats, be it in basketball, cricket, etc. So Mr. David has played his part and would not have been voted back in under different parties if he had not been making a contribution. And I think that in this last term, clearly, he's not in office. And in other terms, when he was not in office, what he could do would have been limited. He was actually in office for 2 of those terms, if my recollection starts me correct. So, but let me just close off by saying that. So I stand by the work of Mr. David. I saw him at work during COVID, and he's a team builder. And he's the person with the experience to take this country, as far as I'm concerned, best person placed to take this country through the challenges that we are going to face ahead. And I'm happy to have on board Mr. Ardy Gill, another very expensive, very experienced politician and person who's dealt with many spheres of life. And we have many other candidates. This morning, we've seen young Holders here, and let me say that I am delighted to have him on board. He represents some of what we need for the future. I expect great things from him, and I wouldn't be surprised. And I don't want to see him in the in Parliament as a senator. I want to see you in the Parliament as an MP, as an MP. And I expect you to be able to, from what I've seen, and as I said, you've come from a background where your leadership skills were shown even when you were at university. You didn't tell the public that as president of the Guild you were. Yes. You don't become president of the Guild with thousands of people from all different islands unless they see something deep within you. And I expect you to carry that same interest forward, and with a deep background in health economics and health-related matters.
Okay,
yeah.
Great.
So,
great.
All the best.
All right. Of course, Mr. Hollis, I want to give you the opportunity. Any closing remarks? Of course, I want to tell you it's a pleasure having you on the program also, and I hope it will be our first or last. Yes. Hope to see you multiple times coming back, and we can get even more deeper into the conversation in terms of your knowledge of what you know more about.
Certainly, I accept that invitation. And like the last caller said, Grenada needs leadership. And I do believe that Grenada needs leadership. And of all the options before us now, I believe that Peter David is the better option for Grenada at this point in our development and where our country sits and what is needed for the future. GT, I want to thank you and all of your listeners for the generosity of your time and for listening and engaging and so on with myself and Dr. Brathwaite today. And I want to remind people that our campaign as the Democratic People's Movement is about people, it's about progress, and it's about purpose, right? And so to break it down specifically to my constituency, St. Andrew Northwest, I do believe that St. Andrew Northwest deserves representation that shows up, that listens, and that delivers for the people, right? And I am committed to working with the people to build a stronger, more resilient future for our beloved Grenada, Carriacou, and Petit Martinique. And like we always say in the movement, together we move.
Right. Gentlemen, I want to thank you once again. It was a pleasure having you both.
Thank you.
Of course, it's always nice to have you folks coming and share your views and even making your concerns and offering solutions also. Certainly thank you for that. Until we have another opportunity, all the best for the rest of the day.
Same to you.
Thank you.
Hey folks, that's we're going to take a wrap for today's edition of To The Point. I want to thank we went way overboard this morning, but it was really well. Until then, have a good one, folks. Have a great weekend to come. Goodbye.